All right, so um, let's get started with this. Ultimately, I wanted to bring you here today to start to better explore exactly what's going on and why from an unexplained infertility perspective, because so many times the women come into clinic here and they've already been passed from pill to post and they've still got no answers. And so whilst I, of course, don't have all the answers either, what I want to do is start to be able to give you a better understanding or a unique perspective of what could be going on and why. And from all my clinical time and all my clinical research, what I've come to better understand and what I'm hoping will be really helpful for you is there are three very specific areas in which we can dive into to start piecing together that unexplained diagnosis. So that's what this webinar is ultimately going to be about. So this is the first of three, as there was far too much information to kind of dissect in just one. And again, this will be very information heavy. What this isn't going to be is it's not going to be a how-to. It's not going to be a quick fix or miracle cures or whatever, because actually what I'm trying to do and trying to better expand there to be a greater knowledge about is the fact that this is such a complex area of health, and that it's so unique to every particular person. And what I often find is, and I'm sure you'll probably agree, is that there's information overload, information overwhelm out there on social media. You can scroll for hours. One says one thing, another thing says another, and it's very contradictory in regards to information. And also, I feel like it provides women and couples with a false hope, ultimately, of what can or can't be the cure for this. And so I want to dissect that in more detail. As I said, it's going to be very information heavy, and hopefully spark a few ideas for you to better piece together your own picture of health, be your own hormone detective, your own fertility detective, and start gaining some confidence in, again, trying to understand that complex jigsaw that's unique and very specific to you and your health. So when I get this ready, what I wanted to do is firstly dispel this myth. So one of the first things that patients come in to see me with, or they say, well, I've read this book, and it might not be this specific book, and I'm picking on this book because it's so well known and it says one thing on the tin, and it's absolutely not that. And again, it's not just this book, it's many, and it's not just books, it's blogs and it's socials. It's only one piece of a very complex puzzle. So I want to look into this in a little more detail. So the book is obviously, it starts with the egg by Rebecca Fett. And from her perspective, she states in her book, the latest scientific research reveals that egg quality has a powerful impact on how long it takes to get pregnant and the risk of miscarriage. Poor egg quality is, in fact, the single most common cause of age-related infertility, recurrent miscarriage, and failed IVF cycles. Now, I have a number of problems with this, as what the book looks at. Firstly, I feel like it's quite misleading and very reductionist in its approach. And it also elicits a certain dangerous choices made by the readers that can hinder rather than help aid in their conception. For example, I think in there's pages and pages of different supplements that patients can take. My point is that all of that is very relevant. All of that's very interesting. But what it's not doing is, again, providing you with that unique picture of health that needs to be specific and tailored to you. And also, it starts with the egg itself is actually not true. And that's, again, what we're going to be looking at today, because it's those types of concepts and those types of facts, should we say, that can be really misleading and lead us down a rabbit hole of that get us nowhere ultimately. So I'm going to explore this in more detail over the next 45 minutes or so. Okay, so before we do that, I just want to obviously go into the stats around fertility as they stand this year, or last year, well, within the past 12 months, should we say. So approximately 3.5 million people suffer from infertility in the UK, affecting around 1 in 6 couples. About 30 or 40% of infertile couples are considered to have unexplained infertility. And I've highlighted this just here because it's not true. Unexplained infertility has an explanation. We're just banging on the wrong doors at the wrong times. And what we need to do is dig in deeper into that. And again, we'll be looking at what those facets are over the next hour. So this is from the World Health Organization as well, just to give you some insight in regards to this not being a new concept at all. This idea that unexplained infertility is actually not an accurate diagnosis. So the World Health Organization say the sheer proportion of people affected affected by infertility show the need to widen access to fertility care and ensure this issue is no longer sidelined in health research and policy, so that safe, effective, and affordable ways to attain parenthood are available for those that seek it. And that's from the World Health Organization. They also stipulate that there is no discrimination in regards to that, because they've looked at various different research across the world from different cultures, different areas of development, different demographic profiles. There is no discrimination in regards to subfertility based on the current research. This is a dis-ease or an imbalance within ourselves that does not discriminate based on anything. So looking at the fertility stats today, and again, we'll get all the boring stuff out of the way, but I do want to provide some context for you and highlight the importance of why we're looking at this. So these, again, are the most up-to-date stats from 2023, so this year. What we can see here is that unexplained infertility is 35.5% of the entire equation. Male factor subfertility is 34.6%, and then male and female factor are obviously a little smaller than that. And I think what I really want to highlight here is that this is a really enlightening new finding for most people, that male factor issues are actually weighted more heavily than female now, and even female and male combined, which is massive. And that's why we're going to be looking at male factor in the second part of this series, because this is one of the biggest things that can help us explain the unexplained when it comes to lack of conception and also lack of being able to maintain a pregnancy as well, so recurrent miscarriage. Again, I want to highlight some stats here. So 1/3 of secondary infertility cases originate from the male partner. So when you go to your doctor and they say, well, your husband already has a child, so therefore it's not him, we won't run a sperm sample, is complete bullshit. So there's lots of information out there. You definitely want to go armed with that information, and you definitely want to push for that sperm sample. But again, this is not oriented around male fertility this week. We'll be looking at that next week. But I want to highlight that importance that actually fertility changes across both sexes. And it isn't based on or isn't relevant to whether or not you've had a child already. So one of the biggest things when it comes to male factor, secondary male factor infertility, is that it's usually a hidden varicocele or low testosterone. But as I said, this is a huge topic, so we'll go into that in further detail next week. let me just take a little look. So let's have a look. ESHRA guidelines. So they're the biggest European organization that look at gynecological and fertility medicine. They have stated that unexplained infertility specifically is a controversial diagnosis, and diagnostic workup is still very lacking. So I want to highlight that over 35 couples, again, looking at the previous slide, 35 couples are diagnosed with this diagnosis of unexplained. And yet ESHRA, who are basically the godfathers of all fertility medicine in Europe, have said that this is a controversial diagnosis and that we need to look into this in further depth to be able to, again, better understand what's going on diagnostically and from a treatment perspective. So it's really, really important that we push for this because currently the way that we're operating in fertility medicine is not sufficient enough to be able to explain that unexplained. But it's not to say there isn't an explanation. Okie dokes. So I want to look at female fertility, infertility here. And actually what we're looking at is dissecting this into 10 different categories. So looking at the primary reasons that, again, have been stated in ESHRA guidelines as being the reasons for infertility for women. And you can see here that towards the end, so 7, 8, 9, we're actually looking at very specific things like immune dysfunction, diet and lifestyle, and the unexplained. So all the others, so 1 to 6, what I want to state here, and again, this is the foundation of what we'll be exploring, is that these are all fall into a clinical category. So what I mean by that is that actually clinically, doctors and your fertility medicine team, they can look at your hormones, they can look at your scans, and they'll be able to put you into neat little categories that, again, they'll be able to either medicate or surgically intervene. So all of these things down here, 1, 2, 3, 4, 5, 6, these are all falling within the clinical category. When we start to look at things like immune dysfunction, diet, lifestyle, and unexplained infertility, actually what we're doing is looking at those subclinical, what falls out of those clinical ranges. So we call this a functional range. And it's here that unexplained diagnosis is really the most pivotal. And we need to start to understand this functional range so that, again, we can understand what we can do and how we can do it to better support our fertile potential. And what I want to highlight here as well, all the patients that come see me in clinic, because I tend to work obviously with quite complex fertility cases, all of them tend to, I would probably say 90%, have an immune dysfunction. And so we refer them directly on to a reproductive immunologist. This isn't something that your NHS consultants ever going to say. It's a lot of the time what your even private fertility consultants not going to say, because it's such a specialist area of fertility medicine that, again, doesn't fall within the typical clinical parameters, but that is really, really clinically significant and functionally significant to be able to address, because your immune system plays such an integral and important part when it comes to not just getting pregnant, but also maintaining pregnancy. And so there are a number of specialists that we refer our patients to around the country to be able to access that level of support. Diet and lifestyle is obviously self-explanatory. That can have a huge impact on those subclinical and functional parameters. And also, obviously, the unexplained is really what we're going to be exploring today. So just so you know, obviously, who I am, So I am a fertility support expert trained, acupuncturist and hormonal health detective. And what my biggest passion is actually trying to support you to help you better understand what's going on and why from your own health. Because there's only so much that we can say and only so much that we can do, but armed with knowledge and armed with the right information and better understanding of your specific picture of health, actually then you start to be able to take control of your health, support that fertile potential, and create really significant health gains moving forward as well. The biggest thing that I'm concerned about is not just supporting patients with seeing those two blue lines, but ultimately maintaining a healthy pregnancy and having a healthy family at the end. And all of that is related to this functional dimension that we spoke about, that looks with the unexplained. Now, one of the biggest things, again, that I feel is really significant when we are looking at this diagnosis is actually we have such a unique opportunity to be able to support our health in that preconception stage, rather than just immediately getting pregnant, having the baby, and then potentially dealing with health impacts, not just to your health, but obviously baby's health as well. So this is a really unique opportunity to be able to support your health now, and throughout pregnancy and postpartum too. And we'll get into a better understanding that as well, and how much of an impact that can have on your health and baby's health and health during pregnancy a little later too. So that's who I am. As I said, I'm very passionate about trying to arm you with the knowledge, so that you have all the information at your fingertips to take control of your health. These are our current stats from a fertility perspective. So looking at 2021 and 2022, these are all patients that follow a very specific program that we work with our nutritional therapist as well. So we're looking at doing all the functional work, all that work on creating your most fertile potential and fertile soil in the body through nutrition and acupuncture as well. We work with women over the course of 12 to 16 weeks to again work with the life cycle of your follicle growth and development, and ultimately work with re-establishing that internal environment so that your cells are working at their healthiest and most optimal potential. Okay. So I want to introduce to you what it is that I'm creating and what I'm developing, and the foundation. And this is just an introduction, this webinar, an introduction and foundation to what I'm going to be offering after this. So it's called the Fertile Foundations, and it's a 4-step approach to fertility foundations from seed to soil. And what I want to do with that is help you reestablish this that most optimal, healthy internal environment, our soil, our inner soil, so that things like that natural seed will naturally grow. The seed obviously being that little embryo too. But that all starts with the soil, and really that's what we're going to be looking at today. So I want to introduce you to this idea of fertile soil. And you might have heard of it as being referred to in a number of different ways. But ultimately, this is the best way that I can possibly explain it to you to hopefully get to start shifting your mindset in regards to how you can approach your health uniquely moving forwards. So Louis Pasteur, he was a French chemist, and he popularized the idea that microorganisms cause disease. This is what's traditionally known as germ theory. So you might have heard of that before, if you have a sciencey background, or again, if you maybe learn it in biology. So it could be a little flip back to your past there. And what he said was that the solution to disease is focused on and reactive to pathogens. Either you seek to kill the pathogen outside of yourself before you're infected, or you take steps to kill the pathogen once you've been infected. And this is based on this theory. Research in science and medicine has focused on ways of killing pathogens with medications like antibiotics, vaccines, antivirals, antifungals, anti-other everything. So lots of things. And all of these are really amazing things, really transformational in regards to our health and longevity. But it slightly misses the mark in answering the question of why does that disease and imbalance start in the first place? And again, this is really where that fertile soil, that soil of our internal environment, comes into play. Because actually, opposing that view, it was a physiologist called Claude Bernard, and he explored and coined the term terrain theory, and views the terrain of the human body as more important than the pathogen itself, because without a poor environment, then those pathogens don't have an opportunity to proliferate or cause disease and imbalance and chaos in the body. And so what we're seeing here, and what you can see here in this really cute little picture that I created, is that terrain theory is the concept of cleaning the fish tank and making sure that the fish remains healthy in a healthy environment. But germ theory is what that's doing is medicating the water instead. And so that's putting the fish back into the dirty water and still expecting it to thrive. Now, of course, the medication is going to have some impact on making that a healthier environment. But what it's not doing is addressing the real reason as to why that water's become dirty in the first place. And so what we need to do here is shift our mindset around us having these problems and then expecting us to be able to either medicate or self-medicate, and expecting significant differences in outcomes, when in fact what we need to do is change our water. What we need to do is replenish that internal soil and work on that terrain so that we can better support and help our cells thrive, ultimately. Okie dokie. So I just want to highlight as well that according to terrain theory, you only fall ill or extremely ill versus mildly ill after the pathogen exposure if your immune system is too weak to fight off the disease. Terrain theory considers the whole individual as very unique. And so what we're looking at here with terrain theory is genetics, health history, diet, lifestyle, environment, and stresses. Again, these are all functional parameters. If we're looking at clinical parameters, of course, germ theory is going to be relevant. But as we know, unexplained infertility does tend to fall within the functional parameters. So there's things that are subclinical in a way. And that's why we have to focus on the soil and that terrain, so that we can better rebalance and reestablish that fertile potential. Terrain theory looks at the entire picture of your health rather than an oversimplified picture in which you're exactly the same as everyone else. And as a germ is all powerful and affects everyone exactly the same way, which we know is not the case. Whilst neither are completely perfect in theory and in practice, both are really important in different ways. And terrain theory helps us to explain that unexplained category as well. Germs are easily identified, measured, and treated, so they can fall into those clinical considerations of health, whereas our internal environment and those factors that impact it are much more difficult to measure, as they are so different from person to person. And again, as I said, that's really what we're looking at here from an infertility perspective, because they're likely they're not going to show on typical labs, and they aren't going to show on scans either. So now you can hopefully start to see why it can't possibly start with the egg, because actually the egg is just a manifestation of the quality of our internal environment. The egg being the largest cell in the body, that follicle growth and development, up to ovulation, all of that, the quality of that particular egg, whilst really, really significant, it can only be of its most optimal quality if actually what we're doing is working with our internal soil and that environment. All of it is rooted in that soil. So that's what we see with germ theory being applied in fertility medicine as well. For example, anovulation is typically treated with Clomid. PCOS, you're typically prescribed metformin. Endometriosis, typically women are prescribed the pill or laparoscopic ablation. Thyroid problems, obviously given thyroxine. So do you see now how it's a balance between germ theory, medicating the poorly fish, versus terrain theory, cleaning the tank and creating a healthy internal environment? So it's a combination of the two, but so much of your fertile potential and so much of that unexplained diagnosis falls within that terrain theory. Okie dokes. By the way, I know this is a whole heap of information, so as I said, it's going to be recorded. You can go back to it and look over everything in more detail, and feel free to ask questions after this as well, or just drop me an email, as I'm very aware that it's a lot. And as potential new concepts to you, I want to give you some time to be able to metabolize that information so that you can start to explain it and rationalize it in your own way, ultimately to help you make sense of it for yourself. And if I can help with that, please just let me know. Okay. So within this, what I really want to do is now explore those three main areas of dis-ease that impact our soil. And when I say disease, it's because actually that internal environment, our fertile potential, is a reflection of our overall general health. Our fertile potential is grounded in and rooted in general cellular health. And so what we need to do is work on that foundation of overall health to be able to support our fertility as well. And so the three main causes of disease that can impact our internal environment, that terrain, that soil, is inflammation, catabolic physiology, so long, complicated words, and oxidative stress as well. So just like lemons, so I'll refer it back to lemons, as you know, this is a Life in Lemons webinar. We build a beautiful, vibrant exterior to showcase to the world, but it's often not a true reflection of what lies underneath. And I call this the bitter pith. So bitter as it may be, each aspect of ourselves serves a purpose. It's important to know that our body only works for us and not against us. So we use those signs and symptoms of a hormonal imbalance as a simple reflection that there is something amiss behind that vibrant skin. And it's this that we're trying to better understand and work with so we can create that internal balance. So we reflect that on that outside of ourselves as well. Okie dokes. So the first of which being inflammation. Now, I could talk all day long about inflammation because obviously acupuncture is one of the best things that I know to be able to address that. And I do that obviously day in, day out. So I'm helping my patients with that all of the time. And so I'm going to give you more information after this about a heap loads of information about inflammation specifically, but just briefly, I want to highlight how important inflammation is in regards to its impact on that internal environment, on that fertile soil. So this is the precursor to pretty much all disease, and it has a huge impact on things like our cellular health, so our mitochondria and how our cells produce energy. It has an impact on your stress hormones, your adrenal glands. It has an impact on your brain function, so those neurotransmitters that help keep everything at ease and at peace, and that facilitate that beautiful feedback mechanism between brain and ovaries, brain and thyroid, brain and adrenals as well. So the brain obviously has a huge, it's like the epicenter of all functioning for the rest of our body. So that being in fully functioning working order is really important. It has an impact on our DNA as well. So this can be seen with things like male factor infertility when we're looking at DNA fragmentation, and that can be caused due to our external environment, but also our internal environment. Predominantly, again, those inflammatory issues that are going on, that we're being exposed to, that can have this huge impact on our DNA. That in itself can have a huge impact on our fertile potential and maintaining a pregnancy moving forwards as well. Please note, though, that, again, I don't want to scare you with that, DNA can be changed. So this is what we call epigenetics. Epigenetics is the idea that, yes, genetic mutations can happen, but we do have control over the way that they show up in our body even after they've been triggered. So lots of information there about that. I highly recommend a book by Bruce Lipton, or even just looking at some of his YouTube stuff, as he is a beautiful pioneer of epigenetics. Things like gut health, obviously, massive impact on our inflammation, how inflammation kind of shows up in the body, and this has an impact on the integrity of the gut lining as well. Your liver is your master detoxifier. So again, if that's out of balance, that's going to be causing a whole load of inflammation as well. And this inflammation causes what we call a catabolic state. So that's a breakdown state. And this is vital for tissues to repair in the body. And it can also, also things like oxidative stress. So those free roaming free radicals throughout the body can also cause inflammation too. It can make the body very sensitive to its external environment and the food we eat, which is why often we see lots of people with things like leaky gut, food intolerances, IBS, IBD, upper GI issues, so acid reflux, heartburn, those types of things. Again, all of that is going to be, that internal inflammation is going to be showing up in the gut as well. But what causes this inflammation? This is where I could go on for days. So I'm just going to briefly allow you to kind of look over this, as I'll be exploring it in greater depth at another time. But really, I don't want to bore you with it all today, as I'm already aware that there's a lot of information for you to take on board. But really what we're looking at is all of these issues just here, that can contribute towards inflammation. So even something so simple as emotional stress can be the precursor to that inflammatory state. And simply sitting, having negative thoughts or worrying can stimulate what we call interleukin-6. And this is an inflammatory precursor. So the body is gearing up to deal with a potential danger, when in fact the danger only exists in our own mind. That's how powerful our thoughts are. And so when people say across the board, you know, if you just stop stressing, if you just stop worrying about getting pregnant, if you just stop overthinking it, then you'll probably get pregnant. I mean, I know that you just want to bang your head against a brick wall and probably punch that person in the face. I fully get that. However, what we are looking at there is there being some relative truth in that, simply because, as I said, those negative thoughts and that worrying do have a physiological impact on that internal inflammation and how that shows up in the body, which has a cascading impact on things like your hormones. So I do just want to highlight that as well. I'm going to be giving out a little bonus at the end of this too, which highlights the 7 key areas of hidden inflammation. So lots of really obvious things like diet, emotions, injured tissues. You see those as being very physical, tangible things that you can do something about. Great. There are 7 key hidden inflammatory issues within our body that we wouldn't necessarily think about, but again, are really significant. And that's when you come to someone like me or anyone in the clinic, and we help you deal with those things, those hidden areas of inflammation that you may not even be aware about, and reestablish and balance there, again, to help dial down that inflammatory response going on. Okie dokes. So all of these things, as I said, can have an impact on our long-term health, and not just impact our fertility, but impact a whole host of other things. And I'm not going to go into it in too much detail. But as I said, this isn't supporting your fertility, isn't just about having that healthy pregnancy, getting pregnant. This is about having that healthy pregnancy, having a healthy baby, and supporting your long-term health beyond that for both you and your family. So this is why it can be really, really important, just looking at all of these things, that we work on that internal environment and supporting reestablishing that soil. So catabolic physiology, this is a breakdown state. What we normally do, and again, I don't want to go into too much detail with this because obviously it's a lot of information, but so you're aware, anabolic is a build-up state. So that's what happens during acute stress. You respond accordingly, and then your body comes back into a homeostatic balance, and you no longer elicit that stress response. So you're feeling calm and balanced. Chronic stress, so that's where we feel chronically stressed all of the time, is a catabolic state. So that's a breakdown state, and that in itself can contribute towards inflammation in the body. It will also impact our internal energy production center, our mitochondria within the cell. So you might have heard a lot or read a lot about how fertility supporting fertility is all about the mitochondria, which is true to a degree. But really, again, the way that we can support that is working with addressing these key areas and reestablishing that fertile soil. So there's a whole load of information there. Again, I'm not going to go into too much detail with this, but ultimately, this is what happens when we are in that chronic catabolic state. I want to highlight catabolic physiology is rooted in stress, ultimately, and those things that can contribute towards that breakdown state are excessive exercise, in particular cardio exercise as well. So lots of women come to me and they say, oh, I'm being really, really healthy, I'm doing all the right things, blah, blah, blah. But they're running and pushing themselves to extraordinary levels. And in fact, cardio exercise is facilitating a breakdown state, so an internal inflammation. Now, if you're in a state of balance, and again, you're not chronically stressed for whatever reason, then you should be able to reestablish that natural balance there when after doing something that is catabolic in nature like that. But usually I would recommend that we work with those anabolic activities, such as weight training or weight-bearing exercises that help to build us up from a deep cellular level, rather than break things down when trying to conceive at the very least. So we have to look at the stress response here when we're looking at things like inflammation. Because again, it's not... There is some truth in saying that stress does contribute towards subfertility and unexplained subfertility, because stress isn't just those external stresses that are around us, but there are also those internal stresses that are within us, those pockets of inflammation that cause that catabolic response and cause that breakdown state within the body, that inflammatory state. So without going into too much detail and sending you back to biology related things and making you feel like you're back in biology class, I just want to highlight here that our stress hormone, being cortisol and adrenaline and noradrenaline, they are used to mobilize glucose into the cells as cortisol itself is the largest glucocorticosteroid in the body. So when you are chronically stressed, you typically find that you have a great propensity towards having insulin imbalances as well. So there's blood sugar imbalances. As I said, I'm all for supporting things like blood sugar balance, and making sure that you, because that obviously is important from a cellular perspective, but we need to, this is my point, is that we need to understand what's causing those imbalances, because it might not just be what you're putting into your body. It might be the fact that you're constantly and chronically in a state of stress, and it could be hidden stresses that are causing that as well. So it's not always about what you're doing or not doing, but actually what hasn't yet been explored or highlighted to you that's causing some hidden inflammation and sending your body into a stress response. That obviously can have an impact on your HPA axis, so your hypothalamus, pituitary, adrenals. It can have an impact on your hypothalamus, pituitary, ovary axis as well, all of which has an impact on your thyroid. Chronically high cortisol levels, so that's your biggest stress hormone, will lower serotonin and lower progesterone. So those women that come to see me and they say, oh, I've got a short luteal phase, or I get spotting before my period. Again, what we're looking at there is there being a stress response in the body. And again, it might not always be what's happening external to you. There could be something going on internally that we need to better understand and dissect that may very well fall outside of those clinical parameters. So looking at those functional parameters to help better explain that unexplained. Okie dokes. Also, just so we can note just here as well as that third thing just here, we're looking at chronically high stress impacting the GI tract as well. So the whole of your digestive tract can have an impact on that. And as we know, your digestive tract is the biggest producer and facilitator and metabolizer of hormones. And so if that's out of whack, we know that hormonally things will be out of whack as well. It can contribute to things like leaky gut, intolerances, IBS, those types of symptoms that typically we just get on with and normalize, but we could be missing on better understanding those significant stresses in the body as a potential cause. Okie dokes. So looking at insulin resistance, as I said, you'll have heard a lot on social media in particular, how important insulin is and blood sugar balance is with regards to fertility. Again, I absolutely understand that there is some foundation in that, because having balanced blood sugar will support your hormonal balance and help to reduce internal inflammation. However, what we're missing there is, and what a lot of people are missing there is understanding the why. Why is it like that? Because it could very well be that you are being the healthiest version of yourself, having kale smoothies every day, and still having those blood sugar spikes. So that's why we need to look at those hidden areas of inflammation and address them to support that fertile soil, to support your fertile potential, and re-establish balance on a deep cellular level that will help to balance this insulin as well. So I just want to touch on obesity, because again, things like high BMI comes into clinic all the time. And I have GP friends who even say, oh, well, my patient had a BMI of 33, so therefore that's why she's not getting pregnant. And I just want to bang my head against a brick wall, because it frustrates me so much. And the research isn't there in regards to BMI. And what we need to do is better understand actually, or differentiate between obesity and higher BMI. So obesity, for clarity, can contribute towards higher inflammatory states. So that increases what we call interleukin 10. And that will, again, that's another inflammatory precursor that is going to be contributing towards that internal state of stress. Again, sending everything else out of balance and causing a whole host of other problems in our bodies too. But high BMI is not the same thing. So I'm not going to go into that in detail here because I've done that in many other videos about why BMI is bullshit. But if you want to know more, please send me a message and I can get that sorted for you. I want to highlight here as well, and then again, from this perspective, from an obesity perspective or from a weight perspective, then women come in and say, well, my BMI is 34, or no, let's say 34. I mean, as an example. So I'm doing everything I can to lose weight. I'm doing a fast, or I'm doing intermittent fasting. I'm cutting out all fats. I'm cutting out all carbs. And of course, all of that is completely the opposite. So it completely contradicts what it is that we're actually trying to do in the body. That in itself, dieting of sorts, is only or often going to contribute towards those internal stresses. So it's really important, again, that you get that tailored and very specific advice, because actually it could be that you're naturally at higher BMI, and that is what is the healthiest version of yourself. Because we can be all those healthy things and still exist in a bigger body. So as I said, obesity is very different to high BMI. What I want to highlight is that we can do all of these things, but what we've got to do is work within the parameters of what we feel is safe for us and what we feel is manageable for us, in order to be able to shift the needle ever so slightly, whatever that looks like for you. So oxidative stress is our third and final contributing factor here towards this that's having an impact on our terrain ultimately. And what we're looking at this is so oxidative stress, for clarity, is an imbalance between free radicals and antioxidants in the body, and it can cause damage to organs and tissues and result in various disease. So you can see here this lovely little apple. It turns brown when it's oxidizing, so when it's exposed to oxygen. And this, what we see with oxidative stress, or exposure to free radicals that are in our environment everywhere. So what we put into our body, what we breathe in, and what we put onto our body as well. How it starts to go brown as well. And this can happen to every cell in our body too, when, again, our internal environment is not addressed. We see this very prevalently with DNA fragmentation, because sperm are so small and so vulnerable that they're very, very susceptible to damage based on their internal environment, which is why DNA frag tests are done alongside oxidative stress tests. But this is still the case for women too. We see it less prevalently, but it's not to say that it's not there and it's not really significant. Again, these can all be tested for through functional tests too. So it's not an unknown entity, it's just not something that's often tested for, unfortunately. Okay, so the cause of oxidative stress, what we're looking at is synthetic chemicals, things in our water, pesticides used in our food, looking at harmful substances. And again, I want to highlight here that newborn babies are typically born with 50 to 70 dangerous toxins at birth, which is massive, and that number is growing. So I'll drop you some information about a beautiful book that a bioscientist that has explored this in great depth. And it's frightening, really. So that's why it's so important for us to work with this now, because what we're doing is preparing for our future and our baby's future as well. So much of what we can be working with supporting that internal soil is the health of our baby, as well as the health of us as mothers too. Okie doke. So you will be receiving these slides if I have crossed over anything that you wanted to dig into in greater depth. So just let us know. This, of course, as you can understand, has a huge impact on our overall health. So things like heart disease, it can lead to severe damage to all our normal cellular functioning, and contribute towards chronic disease like cancer. We can actually measure these things as well. So as I said, it's not an intangible thing here, but it falls within the the subclinical category, the functional category. These are things that cannot be medicated or seen on a scan and therefore surgically addressed. These are all things that we need to work with and identify and address within that functional parameter of health. Okay, these are all the things that we can do about it, working with antioxidants, but diet alone is not enough when we're looking at doing supporting this. We've got a whole host of other things that we need to be doing to better support our body's natural capacity to be able to detox from those horrible chemicals that are causing an inflammatory state in the body. And what we look at here is how much of an impact that has on our three biggest body systems in our body. So all those big three foundations will have an impact on these three areas of our health. So within the Fertile Foundation support program, we'll be working with each one of these body systems to restore fertile potential and improve your internal terrain. Specifically working with, obviously, number one being neuroendocrine, so that's your brain and hormones to de-stress and feel better. Secondly, obviously, your gut, and that looks at your microbiome as well, as so much of your internal terrain and your that inner soil is based on those lovely little microbes. And your liver, so that's your detoxification pathways, as again, that's absolutely integral from an estrogen metabolism perspective to make sure your liver is functioning and supported really well as well. Okie dokes. So here we can see again just ways in which we can nurture our internal soil. They're very, very simplistic things, but again, I want to highlight how simple this really can be in working with this. So there's complex mechanisms behind it, but actually our actions are really, really simple. And that's why I don't want you to get bogged down with and overwhelmed with information outside of this webinar with, you know, social posts and books and this and the other, because actually it's all really simple stuff. You know it already. And what we need to do is just better understand specifically your unique picture of health so we can tailor that information accordingly, so it fits and works with you. But it should be simple stuff, and those types of things are working with a healing diet, and working with dialing down that inflammation, and working with supporting the natural balance within your body, working with things like stress management. But again, that's not just external stresses, it's internal stresses as well. So that can look like a number of different things. Working with sleep hygiene, and obviously exercise. So they're anabolic exercises and not catabolic, so getting you out of that breakdown state. Okie dokes. Okie dokie. So that brings us to the full hour. I know there's been so much information out there, and for that reason, I could have gone on for ages about any one of those aspects that, again, we've kind of gone into today. But really, really important that we cover that basic information, because what I'm going to be doing is sending you through some what they call like handouts, should we say, and downloads, and inviting you also to our resources hub, that where you'll be able to access more information about specifically what we've spoken about today, so that you feel like you've got some foundation to it and a better understanding of it. And if you feel like you have anything that you need to ask for specifically around your area of health, let me know. But we will be looking at those three areas of explaining the unexplained in the coming weeks. So next week we're going to be looking at male factor, and as you've seen earlier in the presentation, in the webinar, that how much of an impact that is or has on your on explaining the unexplained, because actually historically that's never been looked at before. And only recently has there been new insight and research around how significant male factor is. Unfortunately, it's the case that in standard fertility medicine, at least within the NHS currently, is that there's not a great deal that they can do about it. So they typically do a single sperm sample and they're like, oh, it looks okay, it doesn't look okay. And if it doesn't look okay, then you tend to be referred for ICSI. And if it does look okay, then they're like, oh, okay, it looks okay, so that's fine. But what it's not doing is it's not looking at the internal package of what that sperm is delivering. And really, that's what I want to be exploring today, is that you could next week, is that you can actually have a really normal looking sperm sample, but you can have terrible packages on the inside that will be contributing towards this unexplained infertility, when in fact it's really easily explained and really easily addressed, because male spermogenesis, so sperm regenerates at the rate of 90 days, so really relatively quickly. There's so many of them, so again, we've got a lot more to play with in that respect. So working with male fertility is actually much easier to do than working with women sometimes, because there's the lack of great complexity. But we will be highlighting those key areas that need to be looked at and addressed, and that many doctors are currently missing that aren't specialists in male factor fertility as well. So that's what we'll be looking at next week. So if you have any questions, feel free to drop them in the chat. Otherwise, feel free to drop me an email after this.